Hey, it's Shop Talk, baby. This is the show where it's okay to be you. We're talking from Yale to jail and from the church house to the pimp house. Nothing's excluded on Shop Talk. So if you don't have a phone, I suggest you borrow one. Call in and voice your opinion live every Saturday morning from 10 a.m. to 12 noon. Yeah, that's right, 10 a.m. to 12 noon. Don't forget to Shop Talk with your girl, because right here, we keeps it real. Good morning, good morning, good morning. Welcome to Shop Talk with Mel. How we doing this morning?
Wonderful. How are you?
Lovely, lovely. And you?
Good morning.
Good morning. Okay, good morning. Now I'm seeing what's happening up in here. Okay. Today's topic is yuck mouth. Yeah, you heard it right. M-O-U-F. Okay. And today's guest is dental hygienist, Miss Feagins. So thank you for coming on the show. I truly appreciate you.
You're welcome.
Thank you. Thank you. Listen, I wanted to do this topic because of the holiday, especially like the best but the worst for our body in a whole as one, because this is the one that anybody that's on a diet trying to eat right, everybody cheats on Thanksgiving. If you don't, I'm sorry. But that's the one, especially, let me tell you about this. I was gonna have some this sweet potato pie. It was so rich and thick that I could like feel the residue on my teeth.
Oh,
listen, it was good. It was good. The alarms were sounding. Beep, beep, all my alarms were sounding.
wow.
It was really thick, kind of like when you have because your teeth are smooth. Well, hopefully, your teeth are smooth, when they're clean. Now, if you're used to, running your tongue across your teeth and you got some residue, that might be called plaque. But, just dirty teeth, that's a yuck mouth. But after you eat, like with regular, like mashed potatoes, you can eat the instant mashed potatoes. I noticed this. So you guys, y'all see what you think. When you eat the instant mashed potatoes, you just eat it. But if you have potatoes, real potatoes, it's thicker.
Yes.
So that's how it was. And, with your dressing, not stuffing, dressing, okay? With your dressing, all the spices and all the good stuff kind of like get stuck back there, kind of like popcorn skin. You ever had popcorn skin stuck in your teeth, like under your gums?
Oh, that hurts.
It does. It's so uncomfortable.
Uh-huh.
And
That's when your nail comes in handy.
Exactly.
By any means necessary.
Listen, I hope there ain't no potato salad nails.
Right.
Yeah, talking about someone making a potato salad nails out to here, like 4 or 5 inches long. Get out of here. I don't want it. Oh, you did? Yours is cut down. They look good. Nick got her nails done, y'all. They look good. I saw that. Hold up. Bring that back. Run that back. Put it now. Y'all know with the other one, the other hand. Wait a minute. So listen. So for the listening audience, guys, for the sake of COVID and everybody else's variant that's coming around here, where we ain't allowed to go to we're not allowed to go to Africa again, right? Is it South Africa, I think?
Yeah, South Africa.
Yeah. So all the different variants of the corona, and we still doing Zoom. So Nick showed me her nails, but Nick got a rock on that mug. Okay.
I seen that.
Did you see it? You saw it.
Yeah.
That was
Congratulations.
my anniversary early Christmas gift.
Okay, well, happy anniversary to you. All right. Okay, Bernie. All right. That's why y'all ain't moving. That's the real reason why why this date got set back. He like, listen here, I can't do it right now, boo. But I wanted Miss Feagins to come on, and I had some questions for her about mouth hygiene. I said mouth that time. And the importance of mouth hygiene. So let me start with the basics. Are we still brushing our teeth 3 times a day?
Absolutely.
Or did they cancel that culture?
Absolutely.
Okay.
That's a generalized standard.
Is it? And it's still there. Okay. How important is it to brush?
Well, it's very important because the plaque is constantly forming on our teeth, even if we don't eat. So it's important to keep that to a level, because our immune system plays a part in that. And if that big bacteria gets higher than what our immune system can kick in, that's when you start developing the disease that comes along with not brushing and flossing properly.
Is that the gingivitis?
That's the gingivitis and the periodontitis.
Okay.
Okay, periodontitis. Okay, inflammation around the tooth.
Well, when you look at the gingivitis, we're talking about gingiva, okay? And so we're saying inflammation around the gum tissue. So gingivitis is a swelling of the gum tissue. Okay. So we remove the bacterial plaque, that inflammation, that bleeding that comes along with that goes away. But if you don't keep that under control, and like we just talked about, it can progress into something else when the immune system cannot keep up with it, which is called periodontitis. So that bacteria actually goes and migrates under the gum tissue. Now we're talking about the supporting structure, which is the bone that goes in and breaks that down, which makes it periodontitis, because we're dealing with the periodontium, which is the bone structure and the ligaments of a tooth.
So plaque can actually eat away at the bone, the tooth?
Absolutely, absolutely. The toxins will actually start to destroy the bone. And that's when you see people when their teeth become elongated, when they become mobile, you know, because a tooth shouldn't be mobile unless maybe you've had trauma to it, it's been hit. But when you start losing that supporting structure, that's when you start having mobility.
Oh, that's when it's mobility. You're not talking about driving, it's movable.
It's movable, absolutely.
Okay. So like when you say elongated, like Tic Tacs, because I have seen somebody who had teeth like, look like Tic Tacs.
Right. You'll see the teeth will look longer, you know, wouldn't be a normal sized tooth, or you'll see spacing in between the teeth. Oh. That means some shifting has occurred and things of that nature. Unfortunately, as we get older, our teeth tend to shift. There's a process in our body called osteoblast and osteoclast, which is the buildup and the breakdown of bones. So chewing and all of this kind of stuff keeps that system working. So when we lose teeth in that area where you lost the tooth, that system doesn't work anymore. So you'll find less bone in that area, you know, so teeth being there is very important. So if you can hold on to the teeth, that's very important and beneficial.
I read something where it had about, well, it showed, I'm trying to remember because it was a while ago, it had a connection, that's what I want to say, connection of like heart disease with brushing your teeth. You know what I'm talking about?
Absolutely. Sorry about the phone in the background.
Okay.
And don't nobody hardly ever call me, but today they're gonna call me. So when we're talking about heart disease, so that bacterial plaque, as I said, it can migrate, it can destroy bone, but it also gets into the bacteria, into the vascular system, into your arteries, and it actually can cause heart disease. And there's a particular bacteria that you will find, say if you do an autopsy, that's only found in the mouth. We find it in the heart. That's why there's the linkage there.
Okay. Okay. Can it be corrected? Like,
yes,
if I lose what, you know, because that side tooth is going on a lot of people. I don't know if they was eating bristles. You know what I mean? I used to be a gristle biter. But can you like save, like if one is gone, you're like, okay, my mouth is jacked up right now. Can it be reversed? Or can you save like the other 5 teeth you got?
Absolutely. Left. I mean, if we catch periodontal disease early, periodontal disease's former name was pyorrhea. You know, older people know it as pyorrhea. It's gum disease. You'll hear the terms pyorrhea. Pyorrhea has gone out the window, but pyorrhea, gum disease, periodontal disease, periodontitis, those are all diseases with the supporting structure of a tooth. And with that migration, it's an infection. It's literally an infection, and it can systemically kill you. It's an increased risk for dementia, heart attack, stroke, diabetes. There's a lot of diseases that correlate with our oral health.
Wow. Now, what about that? Let me ask this before I get into the extras, the one that they knocking their teeth out and putting fake teeth in. How early should you start brushing a child's tooth? You heard me say tooth. It's like,
when you get the first one in.
Oh, just the first one. Okay. Now, how do you do that though? Like when they're little.
Well, they got mechanisms where you can use. They got little finger caught things. You're sticking your finger in their mouth and you're massaging that. You're massaging the gum tissue, which will help for eruption, soothing the gums. But as early as you can start implementing the finger brush, and then moving on to a baby toothbrush. Also, you want a toothbrush that is comparable to the size of the mouth. I mean, there's some adults that their mouths are small that they still use a baby toothbrush. But the first cleaning a child should get, or exam, should be about 1 year old.
Oh, they go to the dentist at 1 year old?
Mm-hmm.
Okay, so are we still going? Before it was, I remember going to the dentist, you did it once a year, and I would always go when it was time for me to go to school. That's what I remember. Then it went to 6 months as I got, became an adult with my children.
It's 6 months standard.
Oh, okay. Was it 6 months a long time ago when you was in school? Oh, well, I missed the boat. I'm gonna have to let my mama know, because I thought it was just once a year. Everything, and I only remember about, around school, because eye exam, ear exam, everything was right when school was getting ready to start. You knocked everything out. Okay, so these little babies, because I see a lot of the infants with a lot of teeth.
Mm-hmm.
So they need to go to the dentist.
Yes.
At 1 year old.
Yes. And I always recommend that parents get their child, because you don't want their first experience to be a fearful experience.
I was getting ready to say that, because it's adults that's afraid of the dentist. You want the very first visit to be the most memorable. And I mean, you may go for the exam, and it's okay to, and a rule of thumb, a lot of times I would get parents will come in and they bring their children. And so once I got finished cleaning their teeth, we'd sit the kid in the lap or the child in the lap, and I would check their teeth if they would allow me. Now, if not, you just make it a fun experience. But you ask the parent to go home, work with the child, getting accustomed to someone looking in their mouth and things of that nature. So you make it a fun time. Okay. Do you have any questions, Nick, for the dental hygienist?
Now, with adults, when they start getting older and their teeth start spacing, because I started experiencing some of that, I was thinking about going to get braces, because we can't have no gaps in the. I don't do gaps in the mouth. I'm not. What do you recommend with adults getting braces?
So I've had 90-year-old people come in and do braces, only because they weren't able to do it when they were raising their kids. And so when they got them out of the way, they decided to do what was necessary for them. Oh, she went out. So I guess she'll be back. Look, I guess she'll be back. 90 years old. Wow. That was our guest, Miss Feagins, dental hygienist. We lost her, but we'll carry on. Now, 90 years old. I guess people, that always wanted to have braces, and she said, they were raising their children, so now they're able to get it themselves. Wouldn't you be nervous at 90 years old? Getting braces? I'm nervous at 50. Because I'm sitting there thinking like, okay, I don't think I'd be, because you figure like your bones are weaker, osteoporosis probably setting in, so your skeletal system is weakening. So I'm just thinking or assuming, air quotes I'm using for the listening audience, that your teeth will become weak. Right. Yeah. I'm kind of nervous about it, but like I said,
We can't have gaps in the mouth nowhere.
Now I do
Besides,
see, I see that it must be like it's more popular because it seems like older people are getting braces, and that could very well be it. The spacing and the shifting, and they're like, nope, put my stuff back, I'm good. And now it's okay to wear braces. I guess it's socially acceptable because back in the day it was like, oh, they got braces. And you remember all the names people used to call?
Mm-hmm.
And
Exactly.
teasing people. I can't even remember what they used to say. Look,
Metal
I'm like,
mouth and everything.
there you go. There you go. All right, go ahead with the 90-year-old woman.
So yes, I can hear you.
Okay.
Sorry about that. That reminds me back when Mel was down at the radio station. She always
just hanging out. Oh, I know that.
I pushed the wrong button. I'm like, oh. So anyway.
Oh, that's what you did. You did when I did that big board. I was like,
right.
Call back.
Right. I had a call coming in and I know the picture disappeared, so I didn't know how to get rid of it. And I was trying to hang up on the caller.
Yeah, you got it.
And I'm like, oh, they gone, and I'm still talking. But anyway.
Oh. So 90, go ahead. You said 90-year-old.
Right. So I would have 90-year-olds who would come in and they would request to have braces, you know, because they wanted nice teeth. So I don't think there's ever an age limit on what you want to do with your teeth. But the first thing I would say is to make sure before getting braces is that your oral hygiene and your gum disease hopefully would be negative, but that's all checked, complete, and healed. Because what happens is, you can put braces on someone who has periodontal disease. They will lose every single tooth.
Oh, no.
Can you imagine that?
Wow.
Up here gone.
Because when we talked about
But they probably don't know they lost it because the braces is keeping it intact, huh?
Well, it's not that, it's an over time thing. So say we put braces on someone who has gum disease. I talked about the system, the osteoblast, the breakdown, and the buildup. So now we have the function of bacteria whose act is to destroy bone, right? So now we got the osteoblast, osteoplast system working, but you also have strain that the braces are putting on to move the teeth. Now you're spreading the infection.
Okay.
Wow. Okay.
That's crazy.
So when all is said and done, because a lot of kids get teeth, they're not checking their oral health. And I'm not talking about the kids, but whatever facility. They're not checking the oral health of the child, and they're throwing braces on there. Adulthood, they don't have any teeth.
That's messed up.
Yeah, that's crazy.
Especially
so
when
you're looking at somebody, you're looking at somebody in their 20s and 30s with full dentures.
Well, now it's like a style with the veneers, like they're pulling their teeth out to get the veneers are whiter. Listen, what's gonna happen when you wake up? You don't have no teeth, no edges. Like he gonna be your guy or mate. They're
gonna be like, I ain't signed up for this.
They're gonna be like, who are you? It's gonna be like,
right.
You remember that, Nick? You remember that I'm gonna get you sucker? When she was like, no, they was ahead of the game, right? It was like,
right.
Now I get it. I'm like, they told me, don't let me hop after you. Like, you ain't even got a leg either.
Right.
I was like, oh, they was getting it. Go ahead, Nick.
What about this new trend with they've been posting on Facebook? People going around here putting rabbit teeth in their mouth and decorating.
Girl, I've seen that. I've never seen that in my life.
I hope I don't see it.
Years. Yeah. That
so we're making
anybody that would do that, I don't understand it. Yeah.
So buck teeth, all the stuff that people pretty much tease people for now is supposed to be in style. Throw a stone on it.
Yeah.
I'm about to carry me some pliers around. I see it.
Because you got to look, how the heck you gonna eat? Because those fall over your lip.
Right.
Eating?
How do they even
Is it
think that's
something?
food?
Is it something you take in and take out? You know, what's really going on with that?
It looked like a like a nail, like how you put the nails on.
Yeah.
It looked like it was built like acrylic, or
Right, because that's never gonna stay on anyway, especially with bumping and.
Why don't we just go buy some rabbit teeth?
But how
Girl, you could do that. You can have that made, but why?
Exactly.
As my mother would say, why is always a good question.
That's just crazy.
That's just boredom.
You know, you got me at the first smile. If you got some beautiful teeth, oh my goodness.
Oh,
nice, white, and straight, it's over.
Right.
How you doing?
I know somebody who has a beautiful smile, and it is important.
Oh, thank you.
Yeah, let me tell you. And that'll get you that smile. Now, this one guy, we're out one day, and the guy, he was really nice. He was really attractive too. I ain't even gonna lie to you. He was an attractive guy. I'm the friend, I'm always the sidekick. And he was a nice looking guy. And my friend was going for it. And I was like, God, he was so nice. I don't know how he was laughing and everything, but he knew how to tuck them teeth. Like you could see, and his lips weren't like protruding or anything. And then he laughed really hard about 2 hours.
And it fell out.
No, they was missing.
Ooh.
This whole side was, the whole side was gone. And of course, and see, I don't drink, so I know I'm quite aware of what's happening here.
Wow.
I said, she don't know that he don't have no teeth. Now I'm sitting there, she talking boom, 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 and she laughing, having a good time. And like I said, he very attractive, cut up the whole nine. This college days though, okay? So I'm taking it all the way back, college days. And then he got laughing, he got comfortable. See, that's why I said they thought we was having a conversation, and they thought I was nuts when I said, where would you go? Nick, were you were on, I believe, when I was saying I'm taking somebody on the first date to a bar?
Yes.
Because guess the more he drank, he forgot to tuck. So it was like, before he was like laughing, boom, 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 boom. He was drinking, we having a good time, and then he was like, nah. I said, oh. So that's me. She didn't see it. About 2.5 hours in, she saw it. Let me tell you, she was feeling him. She was like, boom, boom, boom. Gave the number. When she saw it, probably about like see that dark liquor something. But listen, probably about it was about an hour before closing. Because if you know me, I when it's time to go, if it closes at 2:00, I'm leaving at 1:30. Because that's when everybody mad that the club is closing. They want to fight. I ain't got that to do.
That's how my husband is. He leave early, and I don't close no bars.
Listen, I'm leaving early. I ain't got time for the riffraff. And she saw his mouth. She was like,
is it a deal breaker?
Listen, it really was, because she asked me to go get her number back. See, this is before cell phone, so I'm dating myself, okay? She's like, go get my number back. I was like, what am I supposed to say? She want her number back? She was like, go tell him I'm married. So that I could be she wasn't, but I could be the protective friend. So I went over there. I was like, you know what? Can I have her number back? Because she is married. She was drinking. He was like, oh, she married. I was like, you owe me.
Wow,
Matter of fact, I'm about to call her. I'm like, you owe me, because I ain't no liar now. You got me out here. She, said she was married, and that's how she got the number back. But it was a total deal breaker for her. And so then there's me, because everything else was good. I said, well, you could get, fixation to his teeth. She couldn't do it because she's seen it already. So I guess that visual.
Yeah. You can't put nothing on the cup on the side of me. If I know that.
No. Isn't that something? It's the truth though.
Call me superficial. Call me whatever. I'll be like, okay. Absolutely.
But is that because you do teeth? Or is that what got you interested in teeth?
Yeah, I've been interested in teeth since 9 years old. So yeah, that's a deal breaker for me.
What about you, Nick? Is that a deal breaker for you?
Yeah, I can see we together and your teeth starting to mess
Right,
when, you know,
right.
you get older. That's a different story. But meeting you and then come to find out you got dentures, bruh. I found out there was one person that I was talking to a long time ago, messing around. Didn't know the brother had false teeth.
A whole set, a grown folk set.
I think the top.
Oh, the front.
Yeah. And he was
No, the whole top. The whole top.
Yes, the whole
You
top.
know, like where you take them out.
But I did not know that. But somebody said that he was talking one day and them teeth happened to
Fell
fall
out.
out. I was like, huh?
Yo, boo.
I knew that before. I'd have been like,
So they fit him nice though, then, huh?
Yeah.
Not too nice if they fell out.
One day.
No, but I mean for her, because she didn't know.
Right.
They
Well,
fit real good. Now, you can't, and when you see him and talk to him now, you cannot tell. But I guess he was talking a little bit too much one day, and they.
Well, the guy that I had dated for a number of years, I had always educated him on how to keep his teeth clean, and so I always asked. And this is, I'm going into something, and I always ask, well, have they ever checked your gum tissue? He was going every 6 months and getting his teeth clean. And I said, have they ever done a periodontal probing, which is to check your gum tissue? Is that
thing they stick up there and measure?
Okay. Mm-hmm. And okay. I said, have they ever done that to you? He's like, I don't remember nothing like that. I was like, well, you ain't getting it done right, you know, if they're not doing that. About our 16th or 17th year of us knowing each other, he was like, I gotta go get root planing and scaling. I'm like, oh damn, beautiful teeth. But if I had known that, because gum disease is spreadable.
Yep.
So let's do some education.
Look, me and Nick both like, wait a minute.
So let's
talk about an STD. Be like, nah, I got gum. Wait a minute. Hold right. Wait, man.
Right. So when you're swapping bacteria, that's what goes on. Needless to say, we ain't kissing no more. But because my mind just can't wrap around that. Whether you got it checked out or not, I'm good. So, right. So the bacteria, if you don't keep that under
what that gingivitis?
Yeah, no, periodontal disease.
Periodontal disease. Okay. Mm-hmm. All right.
Yeah. Well, the bacteria in general, you know, because it's gonna lead, and that's just.
Can you imagine getting a Pap smear? And they be like, "We found." You be like,
"Right. Hold up." So, even with your kids, you know, it burns me to the core. When we are born, let's just say we're pretty much uninfected, right?
Right.
We have good, healthy bacteria. Now you got this parent who want to take your pacifier and put it in their mouth.
Preach.
That gets on my nerves.
And then put it in your baby's mouth. If that bacteria is laced with some periodontal stuff.
She said laced. It is. And you know what the follow-up is to that? What's my baby? They come for me, it's my spit.
Excuse me, yeah. No.
But they're uninfected and you're infected.
And a lot of people don't understand, honestly, that
and if you
once a child is born, that child is sterile. Not sterile for, like, you know, fertility, but
sterile for their body.
Yeah, right. Human. So everything, that's why we have to give them that. That's why they have to get that vitamin K shot. Boom. You got to give it to them so that their blood is able to clot. Like, some people don't realize it. And I'm thinking, listen, I understand that your child came from you and your husband, or, you know, however, you know, children come now. And I'm not being smart, but, you know, it's different ways. But that child that's a sterile being, kind of like a sterile field. So everything is clean. That's otherwise they'd be like, boom, go ahead. You know, had a baby wherever. You know what I'm saying? You got to protect them. And when they're
or
new,
chewing your baby's food and put it in his mouth. Listen,
that's a problem for me. And it's a problem for me because that's like sharing ice cream. You got it. I don't want it. Bye, see ya. Mashed potatoes. Y'all see I'm stuck on the mashed potatoes. I'm done. I don't care how long you be married the whole nine. You're not gonna, and sudsy stuff like an ice cream float, like get out of here. And I gotta say this to you, you know, dealing with the teeth. I have always thought, I said, you know what? There is no way, because that's nasty. Like I can see the inside of somebody's body because I'm looking at it, you know, anatomically, like, okay, this is this. So it's not gross to me. But teeth, vomit, poo, that's the operations of it. I'm like, that part of it is like what it excretes is so gross to me. It's like I can see all these organs, but what it excretes, I just can't. I'm like, look, showing that it's functioning properly, but still, that is the gross part. Spit. I do not like spit, slobber, none of that. How do you deal with that? Yeah, being a dental hygienist, you cleaning and all the suds and bubbles. I'm like, oh, what's in there?
If I don't see that, it's not fun.
Oh my goodness.
What?
Okay, Feagins.
Right.
I am a female who likes to watch pimple popping.
I was about to, I cannot watch that pimple
all
popper
day,
stuff.
every day. All
Ew.
day.
Why? Mm-hmm. Look, for why? You know what the little people say? For why?
Yeah. But why? How come? Why come?
That is so...
I don't know what it is. I've always, even, I think I was about 16 going up to Neocom Medical Center. And in the autopsy, we were reviewing the autopsy. I wanted to get in and pull some fascia away and go in and dive, and everybody else is like grossed out over a dead body. It didn't bother me. So I've always been.
See, a corpse doesn't bother me. I don't, you know, it's just like, oh, okay. You ain't got to worry about it. I remember when I was doing hair though, and shout out to you, rest in peace, Gloria Smith. And she was like, come with me. I'm fresh, just graduated cosmetology, 1991, June 2nd must be my day. That's it. And somebody had passed away. She had to do their hair. I was like, you know, I was like, yeah, but she was like, yeah, I gotta go over here. They paid big back then too, to get the, you know, to do the hair of the deceased. And she shared with me, she said, just look at it this way. If you burn them, they ain't gonna holler. But it made sense though. She was like, you don't have to worry about no complaints, none of that. And she just went there and she said, it's hair. You're doing hair. So to look at it that way, I was like, oh, okay. I still didn't do it though. And then once I got into the medical field, it was like, oh, okay. You know, and you just go with the parts of it. But I don't think the corpse is just like, oh, okay. And knowing the process that way, as far as like the rigor mortis, the color, why the color changes and all that good stuff. But I cannot see someone do a fresh laceration or wound. Like I was
really?
Listen, I was in the operating room, assisting with an endarterectomy. So what that is they cut the artery, take the fat out for atherosclerosis, so he wouldn't have, you know, heart attack.
A stroke. Mm-hmm.
So they cut. So when it cut, it was like butter. So that's why I couldn't be a butcher. So they cut right here and they pulled this up. Bam, had like this fork thing. Oh, I'm about to hit the floor. And I was like, oh, once they did that, the inside, I was good. It was the initial.
Mm-hmm.
So that's why I'm like, that type stuff that you like the pimple popping all that, I cannot do it. So tell me this really quick. Let's get back on track, because I don't want y'all to have yuck mouths, because the holiday just passed and this is the season where all the sweets and all that good stuff is there. Toothbrush. Now, me personally, I like a firm toothbrush. Why, Mel? I like a firm toothbrush because I feel like it's getting cleaner.
Mm-hmm. I don't like brushing my teeth with soft bristles.
It don't seem like it's doing anything, right?
It's not doing anything.
All right, come on, educate us.
So,
and you have told me about that firm toothbrush.
Look at sandpaper, right?
Mm-hmm.
Sandpaper has levels. They have a grade 1, 2, 3, however far it goes.
I don't do that much sanding and cleaning and housework.
Sandpaper of a level 1 is for smoothing, making something smooth.
Thanks for that.
Level 2 and level 3 are for destruction. You want to take it down, right?
Okay.
Soft toothbrush is going to bend and be pliable, so it's sweeping stuff out, right? Oh. If a broom is hard, is it going to sweep real well?
Mine do. I don't know. I like
a hard broom, a hard, stiff broom going to sweep well? Absolutely not.
We had the hard ones back in the late 70s, and you bent that mug. Look, you broke it in.
Right. You see, look
hard. Look at a hard broom versus a soft broom.
I hate it because I got a soft one. It ain't getting it.
Much easier.
Uh-huh.
And more effective.
Much easier
and more effective.
So harder is not better.
No.
Oh wow.
Okay, so you would recommend all of your years, you would recommend what type of toothbrush?
A soft toothbrush.
What about the mediums?
Nope. Same concept.
Not even the mediums.
But your teeth are like super duper white. So let's talk about this toothpaste.
Mm-hmm.
Is it the toothpaste or is it the brushing that's getting your teeth clean? Let's talk.
So when we are born, we have a foundation. Okay. So when a baby is being made, they have the deciduous teeth, which are the baby teeth. Mm-hmm. And then they have the adult teeth, which are the permanent teeth, already at delivery. Okay. And let me say, from a seed standpoint for the adult teeth, because it hasn't yet budded, right? So it's a process. So they're all laid down. So your enamel and your dentin, which is layers of tooth. So dentin is more of a yellowish color, and enamel is what you see when someone smiles. So enamel has translucency, meaning how light permeates it, okay? So the more dense the enamel, the more white it's going to appear, because remember, yellow is up under it, which is the dentin, right? Mm-hmm. So the less layer of enamel and the dentin is there, you're going to see more of a yellow tooth. That makes sense. Did that make sense?
Okay. It did. Let me go to a viewer. The viewer is shocked. He said a hard broom. So what up, B? How you doing? And he was talking about with his tooth. He said he put his back into it. His toothbrush. He like me. That's what it's like. Wait, what?
So we'll see a lot of times in the mouth, we'll see ditching in the cervical toward the gum tissue of the enamel.
Okay.
And that's sometimes the technique that you use brushing on top of a hard toothbrush.
Ooh.
Oh.
Henceforth
Now
to
you about to
sandpaper.
make me go get a soft toothbrush.
Henceforth to sandpaper. And people want to go in and brush, and they want it to be quick. So they think because of a hard toothbrush, it's not going to take that long. I'll get it off. No. That brush is not going to form around the tooth. It's not going to get down into the crevices because it's hard.
But my teeth feel so smooth after.
Brush long enough, your teeth will feel smooth.
What, a happy birthday song? We still doing that?
You know, my rule of thumb is 3 to 5 minutes of brushing twice a day.
3 to 5 minutes?
I was going to say 2 minutes. No.
I thought it was 1 minute.
We doing it on the
minutes.
Let me just explain what plaque is. So plaque, it has levels in its formation, right?
Okay.
So just say I've cleaned somebody's teeth. I've polished them up. They're all nice and smooth. Immediately that pellicle or that next step of formation of bacteria making, it's gonna start, okay? So the pellicle is a layer that comes over and then you get the bacteria and other stuff and it clings to it because it's sticky. So how I teach my patients, if I took caramel, chewed it up, stuck it to a spoon, left it there for an hour, and I come back and I try to get it off. Can I get it off?
No, you got to soak that in some water. Warm water to be exact. Look,
so it takes me longer to
some
clean
caramel
it.
apples.
Right. So it takes longer to clean.
Yes.
Right. So that's the reason for the longer. Also technique. I mean, you can brush your teeth, improper technique. It's not going to do anything anyway. I always tell people to develop a system, meaning if you're going to brush your teeth, start at the upper, say the upper right quadrant, go all the way around, then go to the inner. We're talking on the top. Then brush the biting surfaces, go down to the bottom, all the way around, then on the inside. When you come here and here, the toothbrush cannot be held on the inside with the handle out. It always has to go at the tip.
Oh, okay.
Oh, yeah.
So here and here, because a lot of people, when they go in for cleaning, they always have tartar down here. That's why toothbrush
Down
not getting down there.
Okay.
Right. And so the proper angle for toothbrushing is a 45-degree angle, not a 90. So if you're brushing your teeth and you're coming flat on toothbrush, 90-degree angle, you're brushing against the gum line, not cleaning it. 45-degree, slight tilt, it fans and it cleans slightly under.
Also, we need an in-service in brushing our teeth.
Just
yes,
think,
we do.
Wait a minute, but just think if you had a hard toothbrush, you ain't gonna get that fanning.
Nah, I don't get that fanning. I don't. It's like this is it. Get them corners. We spring cleaning. Like, you know.
Time to spring clean.
For real.
Wow.
And make sure that you're going every now 6 months is a rule of thumb for healthy individuals to get their teeth clean. Okay. There are people who have periodontal disease who have to get their teeth clean every 3 months, every 4 months, rotation with a periodontist, which is a gum specialist, and a regular dentist. So
let me ask you this. I have to ask you this. Why do I have to get x-rays? And this is me personally, every time I go, because I think they're just trying to run up my bill.
How do you find cavities?
Look in there and look for the hole. Look for the black little dots.
Okay, what if it's a beginning cavity?
I don't know about dental.
But I'm trying to get you to understand. It is a diagnostic test. So I'll give you a prime example.
$130.
A young lady comes in. She's in her 20s.
Okay.
Routine cleanings, routine dental visits. The only x-rays they were doing, if I'm remembering correctly, were bite wings, which are cavity detecting x-rays.
Oh, so, okay. That's that thing that they put in there. Okay.
So they were checking for cavities. but you're not going to see the whole mouth. It's very important to see everything, because when you are doing an exam, are you doing a complete exam, an emergency exam, a partial exam? You understand what I'm saying? So when you're going to the dentist and he's doing diagnostic, he needs to completely be able to diagnose you.
Okay.
Important rule. A Panorex. A Panorex is a X-ray that goes all the way around. So it shows the jaw, the sinuses, the nasal cavities.
Yeah, that's the one. That's the one.
So we had, now I'm talking about a 21-year-old woman who has been going every 6 months to get her teeth cleaned. And I take a Panorex on her. She's never had one. Never.
That's the thing to go around.
And she had deciduous teeth or baby teeth that never erupted. So they were up under the tooth structure. They had developed a cyst around it. So it started eating away at her bone.
Oh, so okay.
Her jaw was so thin that if she had bit the wrong way at any point in time, it would have broke.
Oh my God.
Oh, so that's important.
She had to lose every tooth on that side of her mouth.
Okay. All right. I'll accept it. I'll accept it.
How do you know? So when you can visually see a cavity, it's too far gone.
Oh, when they can look down and see? Okay, let me tell you what happened. So I got that, and I just felt that they was trying to run up my bill. Okay, because every time I went, I had to get that again. What is that, Insure? Oh, okay. Is that healthy?
It's not healthy, but it's necessary.
Okay, all right. So I go there, I get this x-ray, and then they put that thing on, that like RoboCop type spin around. I'm like, what is this? And I go lay back in the chair. I lay back in the chair, the dentist comes in. She was like 8, 14, 13, 21, and 29 or something like that. Now I'm back in the chair and I'm looking at my teeth. Let me tell you, I have never got up so fast because they got me laid back. Now, why you calling out all these numbers? So, and then it was 5. I might have some, but I think 8 was 1 because that's my favorite. He was like, oh, okay. And then they talk about something. So I'm thinking they're going to take out 8, 13, 14, 29. You know, I'm like, I got up out of there. I paid my bill when it came. And I went to another dentist, i.e. Bling. Y Bling. Shout out to Y Bling. I was like, no, you can't do that. So what is that? What is that about? What is the calling off these numbers? And then
he's like, talking about.
And then he hit me with one of these. He hit her with one of these. Like out of concern.
Well, numbers are done for communication purposes, so that we know.
Keep talking.
So that we know what needs to be done, right?
Okay.
So that's the communication mode between the doctor and the assistant or the hygienist.
What's 8? What's 8? Tell us what 8 is. Oh, I knew it was something major. That's my front tooth.
Yeah.
Right.
Now, he could have been 8 periodontal disease or bone loss. He could have been 8 needs a 8 needs an incisor or MO. And that's just telling surfaces that may need to have fillings or cavities, and that's their mode of communication. Now, when he got finished talking to her,
which one is the 8?
He needs to be educating you, the one to the right side.
To my right, so that's this one.
Mm-hmm.
Now, I had a piece of popcorn skin that was stuck up there for a long time, that it began to abscess.
Mm-hmm.
And it's actually longer than this one, if you look closer.
Mm-hmm.
All right, maybe I should apologize. I'll send a thinking of you card to that dentist.
Mm-hmm.
A holiday. Look at that. I'm like, because I left them calling out all them numbers. I'm like, to me, the dentist Calling
Right,
out numbers, that means you about to take these out.
You talk to me, let me know what's going on.
Yes.
Well, that's gonna occur. They gotta assess first before they can talk to you about anything.
Okay.
So that's just a mode of assessment.
Oh, all right. Because I'm like,
Mel, you said you got out of Dodge.
I got out of Dodge. Listen. And they
And
sending
she probably,
I might send them
she
a
probably
Christmas
was on the
card.
phone. Feagins, I need a dentist. Feagins,
Yeah,
I need a dentist.
was. You already know. I'm like, I'm out of here. Listen, I was laid back. I couldn't even. I felt like Fred Sanford when he be like, Elizabeth, I'm coming. I couldn't get out that chair fast enough. I was like, I got the heck out of there. But I'm gonna send them a Christmas card.
Oh goodness.
I'm gonna send them a Christmas card. I feel bad now. That was about what? 10 years ago?
Wow.
Almost. It's been a while. I'm gonna send them one of these. Just thinking of you.
Wait, wait a minute. No, make a CD of this.
Yeah.
And send it to him, and it be like he'll understand why.
Yeah, now I understand. God, I was gone. No. Okay, so you said a soft toothbrush. Mm-hmm. What would be your recommendation of a toothpaste to get that works good for cleaning the teeth and whitening? And because see, I'm a little nervous, and I'm gonna ask you about that real quick before we start the round table. These are our Shop Talk questions of the week and our good stuff there. The trays. The people they order. Well, yeah, they've been ordering. They got like teeth whitening trays. Is that healthy? I know it's so many. So I'm just asking you. Let's say the ones offline and not from your actual dentist. Let me clear that up a little bit.
If used properly, and how they're supposed to be used, it's okay. Now, can you get side effects from that? Absolutely. Do you want those side effects? Sensitive teeth, hot and cold issues.
That's sensitivity. That's that. Don't they got that special
burning of the gum tissue?
Burning of the gum tissue.
Right, but we're talking about using properly. You know what I mean? If you put too much, it overflows. It gets on the gum tissue. You know, those are things that with anything, if you don't use it the way it's supposed to be used, it will not work properly. I.e., a hard toothbrush.
The shade. All right, we're gonna go to a viewer. Hey, listen, wait a minute. Let me put this number out here, Nick, and then you could go. If you want in on this conversation, or if you have questions for Ms. Feagins, please feel free to do so. Call in at 619-902-2287, 619-902-2287. If you don't want your name said on air, you can always text the same exact number. We're here for you, 619-902-2287. The viewer, real quick, Derek, he said peroxide and some baking soda. What's your thoughts on that?
Caustic. Peroxide is caustic. It burns.
Oh, wow.
It's toxic.
Caustic.
Okay, what is caustic?
Meaning that it'll burn.
Okay.
Like aspirin put on the skin will cause burning.
Mm-hmm. But a lot of people don't know that. See, now we learn it. Go ahead, Nick.
I didn't know that either.
See? But, we learning today.
Bob asked about battery operated toothbrushes. Are they good?
The electric toothbrush?
I would do an electric toothbrush before I would do a battery operated. Again, technique is very important. So I do, there is some efficacy in using a automatic toothbrush. Braun, Oral-B, Sonicare. Those are good lines of toothbrushes. You need to change the heads every 2 to 3 months. A water pick is very good.
That's what I was going to ask.
Conjunction, yes, a water pick is very good, especially for somebody with gum disease. I really do recommend a water pick. Proxa brushes are good, but yes, a A water pick is, I mean, a automatic toothbrush is fine.
So wait, so there's a difference between a battery operated and the plug in the wall electric toothbrush? They both got it. You got to click on, right?
Yeah, but some of them don't move. Some of them don't have the same mechanisms that a Braun, Sonicare, or Oral-B would have.
Now, see, she about to make me go get the whole system.
I know, Nick. I know. That's what I'm sitting there like, oh, wait.
Because I'm learning stuff I never knew.
Braun, Sonicare, and Oral-B, this is not a promotion, but you owe me. Okay, that's
right,
it.
So tell me, like when you were talking about the regular toothbrush, and you saying you can't get like on the inside of your bottom teeth because
I didn't tell you can. I said,
well, you said you got to go up and down and not your regular brushing, the regular way you brush your teeth. So with those electric or automatic toothbrushes,
same thing.
Oh, you got to hold it the same way because don't they go in circles and then they go back, reverse, and all that extra stuff?
Some do, some don't, but yeah.
Okay.
But the vibration or the sonic mechanism is what is supposed to agitate it out. So.
Okay, so the agitation is what's actually cleaning your teeth. Okay, now we talked about the electric toothbrush as well, the automatic. You said change the heads every 2 to 3 months. So for a manual, because I'm trying to exercise and get rid of these recipes up under my arms hanging.
Girl.
Right. So for those, that's every month though, right? So manually, we got to change them every month, but automatic, we got to change them every 2 to 3 months.
That's their recommendations. Yeah.
So toothpaste. I didn't let you answer when I asked you that question before. Toothpaste.
So when we talk about toothpaste, I have some. It's not necessarily toothpaste that cleans the teeth. It's the mechanism of the action of the brushing. Remember, we talked about technique. So that means you can use toothpaste all day long.
Wrong technique, your teeth still not clean. Okay.
So when we talk about toothpaste, there's so many toothpaste on the market. My recommendations are a regular toothpaste with nothing in it. It has the fluoride, or you can use the more healthier one, the Tom's and Maine and all of that kind of stuff. So, when you get into using Colgate whitening, and here again, sensitivity, tooth sloughing, because of the chemicals that are used in it. Wow. They're chemicals. Now, the one thing that I don't like about toothpaste now and what has changed, they're using a compound called hydrated silica, Silica, I think it is. So hydrated silica, if you look at and actually what it is, it's ground up sand.
Sand and my farm toothbrush?
What?
Right.
So I'll give you a prime example. I'm working at a dental office, and he has all kind of toothpaste there. And, I'm like, don't even pick up whitening for me because I don't recommend it for my patients. So he has some sensitivity toothpaste. Okay. So we're talking about toothpaste that is supposed to be treating sensitivity.
Right.
So within a week of me using this toothpaste, just for me to go, take some air in, my teeth were hurting. If I drank some water, and it didn't have to be real cold water, my teeth would hurt. And so I go to him and I said, there's something wrong with this toothpaste because my teeth are sensitive. It's not the toothpaste, it's something else. So me and my ignorant behind, I get online on my lunch break, or I get on the phone on my lunch break and I call Colgate.
Oh, you call the company. Okay.
So I said, look, I've been using this for a whole week. I said, there's something in your product. Is there anything in your product that causes sensitivity? Well, hydrated silica is known to cause sensitivity.
Well, then why you putting it in your toothpaste, Colgate? What's wrong with y'all?
Wait a minute, but for sensitivity.
Toothpaste for sensitivity, they're using it. So
Sensitivity.
you were able to tell him, did you tell him, Miss Feagins? I know you did. Did you quit that dentist like I did mine? Do you need to?
Wow.
He didn't like me after that. He didn't like me after that. Now I can't.
Oh, I'm like, did you fire your dentist? Now,
well, no, I work for him. I work for him.
Right. That's right. That's right.
So he a dentist? Listen, you can't look in my mouth and if you recommend this stuff and you ain't looking, nah, bro. Mm-mm.
But you know what though? Kind of like the drug reps though. You know, they come in and it's like, here you go. And so I'm glad. I suggest everybody, look, I recommend everybody, if you have questions, check it out. And don't just, you know, this is a new day. Like our grandparents believed everything the doctor said.
Absolutely. And you got to be very, very careful nowadays.
Right.
Look at Miss Feagins putting that lip gloss on. Lips popping, okay. What? Now, your teeth are really white. There was a toothpaste that you used to use a long time ago. Is it still out? I can't remember. What's the name of it?
Your mother keep asking me that. And the only thing that I can think of would be Breath RX, because that's what I have upstairs.
How much is it a tube? How much is it a tube?
About $10. It might be $13 now.
And she's spending $13 on toothpaste. Lord, we doing it all wrong.
Right? Listen.
Well, let me just educate this. When we use toothpaste, we use it wrong. Okay. A lot of people, they go.
What's that black toothpaste? Wait, what's the black toothpaste?
That's charcoal. Not good. Awesome. But anyway, you take the toothpaste and you put it the whole strip along your toothbrush. Improper. It's a pea size.
Really? Wow.
At $13, and we know what.
I have patients and they're like, well, can I get some more toothpaste? I just gave you some. I'm out of it.
Now, see, you know what, though? I might respect toothpaste at $13 a tube because I put it on the whole brush, like you said. And then, of course, I got to run it up under the water and then it falls off in the sink. So now I got to put another strip on, so I respected it. But
so
what's the name of that $1,000 toothpaste again? Would you say Breath RX?
Breath RX. She said $1,000 toothpaste.
Okay. Now, can we get that in our regular stores?
Only Walgreens.
Oh, only look, shout out to Walgreens. I'm about to go up there and get some ads off these people. Listen, Mel, real quick.
We got a viewer? Okay, go ahead.
They cutting up.
Go ahead. Go ahead and read it.
Derek was like, how is it that a person has perfect teeth but breath smell like death?
Oh, there you go. How important is flossing, Feagins?
So, not flossing increases your risk for heart attack, stroke, diabetes, and they found prostate cancer in men.
Ooh.
And if you wanna Google me and find out if I'm telling the truth, Journal of Male Health.
Okay. So now, why is the breath so bad? That's because they need a cleansing.
But he ain't have to put it like that.
They need a cleansing. What's inside trying to come out?
Well, it doesn't necessarily.
With good teeth.
So
and they breath be like.
There are some stomach issues that people can have. And so I don't know if Mel remember, we were downtown and it was when she was doing her show. And this lady kind of came up and walked up to her and was like, hello. And then I was like, dang, she got periodontal disease. And Mel said, how you know? I said, I can smell it. Now, Mel working where she worked, she didn't have problem telling people they had STDs and whatever else. Why? Because she knew the scent.
Yes.
There's a scent.
Yes.
I can smell, I'm like a dog. I can smell periodontal disease.
Yeah, listen, you remember that? She was like, hello. Oh.
And I was like, oh, Jesus.
Miss Feagins being professional. I ain't know where it came from. So for our Shop Talk viewer, Derek, I got hit before. I got hit. But I'm thinking that, like, since we all wearing face coverings, and if your face coverings smell, then that's your breath. Like,
but when that's been all along,
subjecting us to. So now you get it.
But when you've had that all along, that's normal to you.
Now, if I had, you ever put a mask on and smell it, be like, ooh.
But
when
wait
it's
a
brand
minute.
new?
Like, so
But wait a minute. You missed what I just said to you.
Yeah, it's normal for them.
That's
like
just like, okay, so this is one of the things that I tell my patients. So I'm like, if you had a little patch on your hand that every time you washed your hand, it bled, you run into the doctor, right? Because something wrong. Because my hand ain't supposed to bleed, right?
Right, and I ain't on no blood.
But how many times do people brush their teeth and they spit blood in the sink and think nothing of it? Why? Because they've been doing it since they was kids, because kids can have gum disease and gingivitis.
Good information.
It's normal.
Now, I'm
about to be a hypochondriac of the teeth now.
Right, but wait, I attribute it to my firm toothbrush. Like, cause it doesn't happen all the time, but when it does, I'll be like, oh, because I feel the scratch too. I am not gonna lie. I feel the scratch in the back when I go too hard. I was like, oh, and then I'll see it. But then there's those who feel like their teeth aren't clean unless it bleeds. They brush them until they bleed.
I can brush my teeth all day long and you ain't gonna find no blood.
That's because you're using a soft toothbrush. Get the hard broom.
Listen,
actually, Hunty, I use the super soft.
Do you?
I got a question. Okay, halitosis. What's the difference between that and then you being able to tell somebody got periodontitis or whatever it's called? Like, because he was like, so that's not halitosis?
So there's something called, there's a gas that is released from the back of the tongue. It's called sulfur. So sulfur has a specific smell.
Yeah.
Right?
Y'all know that sulfate.
That's how my hair grew when I was
It ain't the sulfate smell, but you understand what I'm saying. There is a condition from the stomach in which you will have bad breath, but a lot of people don't clean their tongues. I mean, every day I tongue scrape my tongue.
What if you have a sensitive gag reflex?
Breathe through your nose and relax your tongue.
How? With a sensitive gag reflex.
Breathe through your nose.
What if you got sinus issues and you can't breathe through your nose?
A lot of times the gag reflex is because you're not breathing through your nose. Mouth breathing will cause you, automatically it's going to cause you to gag. Okay. And how I've had patients, I don't know, and there's probably a lot of people who have had x-rays and they gag with the x-rays. One of the reasons they're breathing through their mouth. I've had patients say, oh, no, you can't do that x-ray on me because I gag with it, right? And I asked them, do me a favor, breathe through your nose, relax your tongue, and when I push, don't push back. We don't have a problem.
Well, let me tell you about your doctor that you work for. We ain't gonna say no names. So I told that doctor when they, remember, I'm dating myself again. Was it the fluoride trays? I said, you can't put both trays in my mouth at the same time because I won't be able to breathe. And I said, and I'm going to vomit. No, they're gonna put it in there any other way. Who vomits? Me. Because I believe of that very same thing. I really can't breathe out of my nose. I'm always clogged up.
Because you wash your hair and go outside.
Yeah, I do. That's old wives' tale.
That's
old wives' tale.
No, it's not. Nasai had the same issue, and once they stopped that, she don't have that issue no more. So no, it's not. Okay, go ahead.
Well, I'm gonna keep
shampoo. And we digress.
Right. I'm gonna keep shampooing my hair. Y'all want to wash y'all? Look, you and Nick. Y'all want to wash y'all hair once a month? Go right ahead. I'm joking. Y'all got good hair. I just had to say that. Otherwise, they'd be sitting there like, oh, that's racist. Oh, she black too. Okay. Nick, any other questions from the viewers? Did you see any? Let me check this phone because y'all know how I get involved in.
No, I was just laughing at Derek and then Bob because Bob was like, when she said Costa, he was looking for a cheat sheet. They show it out. Just show it out.
Okay, sorry, I missed really the call. My apologies.
That needs to be put out there because back in the day, we were told like make sure you go to the dentist once a year and this and that, and it's not that now. And
6 months.
Yeah, every 6 months. And then with the toothbrush, regular toothbrush, I didn't know you have to change every month. I thought it was every 2 or 3 months. Excuse me. So yeah, she about to make me go out here about a whole system, the water pick.
Okay, so let me just say this. When we're dealing with quality, so you buy $1 toothbrush, say versus your $7 toothbrush, right? When you expect better quality?
I would, but people jacking their prices up like this whole Black Friday thing.
No. But understand where I'm going with that. So say you're buying a toothbrush and it's from the dollar store. We don't have the quality bristles when you find bristles coming out in your mouth when you brush it. You know what I'm saying?
Oh, yeah, we ain't doing that. I don't do that.
And so a rule of thumb for checking for how long or when you should change your toothbrush. I tell patients anytime you see, so you know how when you get your toothbrushes straight like this, when you start to see those bristles do this, and I'm talking about the first sign of that, not doing what it's supposed to do.
No, when they do that, the only time mine did that is when I use my toothbrush for baby hair. That's the only time they will flake up. But see, that was in the 80s. In the early 90s, when it, I don't know, I have not.
Well, the next time I come to your house,
like that.
Next time I come to your house,
you check.
Let me see your toothbrush.
You can see it, honey, and you can see, and you can see all my dollar toothbrushes up there that say Firm because I can't find them in other stores.
Right.
But listen, so for dentures, it's okay to use the Firm.
Well, for a denture, you should be using a denture brush. That's what it's designed for.
Oh, they got denture brushes?
Mm-hmm.
Oh, you see, I didn't see that. Listen, okay, my Christmas list. Listen, I'm just going to put this out here because I remember the one time I said I wanted orange juice and I had like 4 gallons of orange juice on my porch. So I appreciate y'all. The people that know where I live. I want to get me, I'm going to try one of those electric toothbrushes.
A water pick too.
And a water pick. Those feel good. They do feel good when they used to spray that. That feels real good. So,
matter of fact, you can have mine.
I want yours. What you talk about?
Why wouldn't you want mine?
Your toothbrush?
No, my electric water pick and toothbrush. You can change the heads.
Oh, all right.
They're universal.
All right, because I ain't trying to get the periodontal.
You see how she looking at you?
Yeah, I don't want to get the periodontal. or Derek.
I ain't saying use what I put in my mouth.
What happened? Thank you. I appreciate it. I like my gift. Thank you.
She's giving you the mechanism, not the.
Oh, yeah, I got to go buy the other stuff. I'm fine. I'm good. Listen, don't be bringing that to the regifting party.
You know it's coming, don't you?
Like, boom, this one got a name on it. This one got a name on it. Right? I'll be liking it. She over there thirsty. I hope she's not dehydrated, but I'm watching you. I'm checking you out. I'm watching your neck. I do. I be assessing, just like you do with teeth. So the first thing you look at, I look at everybody's face, their eyes. I'm looking at their neck, the jugular scene. I'm like, oh wow. So
I didn't know until I went to the heart doctor that you could actually tell through looking at the jugular.
Yes.
The fluid.
Yes.
It's called Volmic or something like that system. So
hypervolemia is what I know. That's the other term. And you can see it and you'll be like, okay, and you can tell who will potentially be going into congestive heart failure and stuff like that. So I do that, and I look at ankles, I look at feet, I look at socks, but you look at, the ankles will tell you you've got cardiac issues.
And the stomach will tell you too.
The stomach will tell you all the other things that you can have, because it's a lot. But that left side, if you have, look, and this is a whole, look, we don't stop, look, we talking medical up in here. The left side, because we got to hurry to get going. The left side, like if you have swelling in the left leg, like when I look, they be like, oh, my feet are swollen. I'm like, oh, okay. And I look at that left side will tell you everything.
Well, it'll be screaming at you when you see me there, because my left foot is always swollen now, my left leg and everything. And I'm attributed to me sitting all the time for work. But yeah, there's heart disease in my family, so I know I have to go to a specialist to get checked. Just because.
Well, let me say this. Wait a minute, 1 second. Let me say this. Bilaterally, if you have swelling bilaterally in both lower extremities, your left and right leg, then you can attribute that to sitting all day, because there's a thing called dependent edema. If it's your left leg, look at cardiac. So you don't need to wait around for that. You need to just go ahead. I know you're not trying to go into the ER right now from the way things are, but you definitely got to get that checked. So contact your medical doctor and let them get the fluid off. They'll probably prescribe something like Lasix or HTTZ.
My mama took that off.
But listen, I'm saying this right now. This is, look, off script.
Yeah, don't play with it.
Look, all our stuff off script. But let me say this. Listen to me. You had that, you have to do that like immediately. Call your doctor immediately, because time is of the essence. And that's nothing that, you know how we like to self-diagnose and kick our feet up like, okay, get this. That is not okay. That is not okay. And if you find yourself laying down and it's hard for you to breathe, and you have to like be elevated, that's because that fluid is rising. So
in your lungs.
And I don't want that. I ain't got time for that. And I ain't got time standing behind no microphone speaking.
One of my strong recommendations to you, and a lot of doctors don't do this test, but because you have a genetic history to that, it's called the lipoprotein A and B, okay? That is very critical to know, because it will tell you your predisposition to a disease, okay? And then you, right. And
this, wait. But this is what I'm gonna tell you how to do it though. Write it down, people. And then when you get the blood work, you ask the doctor after, like, was this included? Because then they could go ahead and test it off of the blood that's already taken. And you don't want to act like, because some people, they got that where they feel as though like Miss Feagins, Dennis, they know it all and this is it. And then they have an attitude with you. Then you got to fire your doctor. Like Dr. Mimi said, find another doctor if you're not comfortable. Okay. But ask them after, and you are your best advocate. Know that. And if you feel like you can't communicate with your doctor, then boom, time to find another doctor. But let them do what they're going to do, and then ask them if that was included. And the reason I say that, yes,
not a routine. No. This is what
I know. It's not routine. I know. Yes. I know that. That's why I said you do that, and you ask them if it's included. Now, if you go to the ER, sometimes you have a great resident that goes over and beyond. I like the residents because they go over and beyond. And that's when you ask, like, well, was this run? And you got to make sure you give them that history, that your mom, you know what I mean? That is so important. A lot of people don't realize that. when you fill out the questionnaire, but we're not filling out questionnaires anymore, honestly. We used to. Remember that whole sheet, come in 30 minutes early or an hour early, you fill out the sheet. I don't know what happened. I guess people just don't have the time at the office. And Dr. Mimi actually said that you were on there, Nick, on that show where Dr. Mimi was saying that there are allotted 15 minutes per patient.
Right.
Oh, that's a standard. Not a lot. That's a standard.
No, I know, but it used to be longer. But now, so that's why she was saying when people come in that they'll have to say, make another appointment. And it's sad. It's sad because you're like, okay, I'm rushed. That's why I tell people when you're getting ready to go to the doctor and you're at home and some of us feel like, okay, I'll remember. No, write it down, because after you finish talking and having a good time with your doctor, you leave and you be like, I forgot this and I got to make another appointment. Or I forgot that, because they're busy with other people. So write everything down, and you got that 15 minutes, make sure it's used all for you. Here, and then go from there.
Now, they done got so bad that they'll tell you, I can only address one thing. They're not addressing more than anything else.
She said that. She said that. But but write it down still. And then you might have that doctor be like, boom, 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 and can, get you some answers. And then they'll tell you to go ahead and, make another appointment. But write it all down. And 9 times out of 10, I'm actually going to stand on this. When you write down all your complaints, it might be stemming from one thing.
One thing.
And then that's when they can give you that referral right then. You know what I mean? So it's, time is of the essence, and that's it in a nutshell. All right, let's do this round table real quick. Hot topics, do the shop topics. What you got?
Well, Mr. Chappelle is at it again. He apparently went to, he was scheduled to go to his old high school, high school to speak. And the students found out and they didn't want to see him. So, they were threatening to
from him because they feel as though he's transphobic, and he's not. Go ahead.
Right. Well, they did end up getting him in there anyway, but they didn't tell anybody. Parents just got I guess a text message or whatever saying that the kids would be out of school 30 minutes late because they had an assembly. Well, the assembly was him going, and the first thing out of his mouth is he was saying, I understand a lot of you have an issue with me. If anybody has an issue with me about, my show and me with, the transgenders, and come forward and start talking. Well, a lot of them was trying to talk to him when they came forward, and, he over talking them, and just like, he was just.
So where did you get where'd you get this information from?
Facebook.
I saw it on the news, the little news channel on Facebook, and then then I just looked up Dave Chappelle, and all kinds of.
I wonder which news outlet, because even Facebook, they use news outlets. I was wondering which outlet that was. I'm looking
at the Decider now.
The Decider. Okay.
A bunch of them are coming up, and they're saying, even his publicist is trying to smooth things over, and I guess there was like 2 transgenders that talked to him, and like he was just basically the whole no punches with these kids. The one little kid was like, I'm 16 and I think you're childish, you handle it like a child, and he went in on that one.
Now let me say this in his defense, because I didn't see it. I'm gonna check it out. First of all, it was a fundraiser that he was supposed to be doing, and that was, that's his area. And the students didn't want him there, because of how he felt. So it was like, okay, right. I'm glad he still went and he was able to talk to them. But here's the thing. There's a difference between we can agree to disagree, or let me hear your views, and and disrespect.
Disrespect.
Mm-hmm. So there is no 16-year-old that can come and talk to me telling me that I'm childish, because guess what? Our conversation is over.
It's over. Yeah. And he told him, he was like, my friend, with all due respect, I don't believe you can make one of the decisions I have to make on a given day. But then,
And he has children. So
Right,
you have children
exactly.
that's older than somebody, and I'm not trying to cut you off, but we got to hurry up because of the time. You can't talk to people crazy. You can voice your opinion, you can voice your views, just like you guys know. My motto here is it's okay to be you, but there's a thing called respect.
Right. Well, he did step up for the kids too, though, because he found out afterwards that a lot of the few of the students that did get up to talk to him were getting bullied afterwards, and he said that, you know, he was like, this is my family, and whether they know it or not, I love these kids. I don't want to hear about any threats to these kids. These kids don't deserve that. So, you know, he did do that. But yeah, he was coming at.
They also called him a narcissistic person.
Now, why that term is used so loosely? But go ahead, Feagins. Tell me about the narcissism.
But that was one of the students referred to him. If I'm not mistaken, because I didn't read the whole article, but one of the students had said that he was narcissistic.
He was narcissistic. Yep.
See, I don't get that from him. So, but what I do get where the whole cancel culture people, and I'm saying a group. So if you are in that group, there you go. I said it. The cancel culture people tend to use the word narcissistic when they don't agree and you don't break.
Well, we use racist in the improper term. Everything is racist now.
Yes, that too. Get out of here with that. Just because I don't agree with something or I have a different preference does not mean that I'm racist. And that bothers me too, because they try to throw that out there like all white people are racist. Just because they don't agree or they're raised this way, or, you know, from their culture, and then we have our culture, and if their culture is different from our culture, you want to call somebody racist, that's foul.
But look up the definition of racist. Look up the definition of racist, and a lot of things we're calling racist does not fall under the description, the definition of racist. A racist is someone who is against another race. That's racist.
Right. Go ahead, Nick. You're muffled. You're muffled, Nick, so I can't hear you. You were called racist on your job? Yeah. I can't hear you. Something's going on with the phone. Hit mute and unmute, or your computer, I'm sorry. And then unmute. Hello? Nope, it's still, I don't know. We can hear you a little bit, but it's like, what happened? You could go out and come back in. Okay, so listen to this. Let's do this real quick. Thanksgiving, round table. Thanksgiving.
Whether it should start at 4 o'clock or 5 o'clock.
Yes. What time? No, and it's the holiday season. So Thanksgiving meal, what time do you think it should start?
Whatever time you set.
Okay, well, I ain't coming if it's like 5 or 6 o'clock because I'm sleepy. But I say 4 o'clock, 3 to 4 is a good time.
See, for me, I would be 1 or 2. I don't want to wait all day to eat.
For me. See, that's the Christmas meal.
That's all meals. If it was Thanksgiving, if it was Christmas, don't send me all day to get my food that I've been waiting for I don't know how long.
Yeah, because you know how we do it. We don't eat all day until it's time for the actual meal on Thanksgiving.
Right. So you gonna starve me until 4, 5, 6 o'clock, and then tell me to be there at 4 o'clock, and then don't start till 5:30, 5:35.
4:35. Go ahead, Nick. Hello?
She ain't back
on
yet.
Can you hear me now?
Yeah. So tell me about you were called racist. Go ahead.
We get called racist all the time, and it's usually, and excuse me, I'm not trying to be, I don't want nobody to come after me, but it's usually from the of Indian descent or the Arabs. They're good for calling us racist when they get a denial letter in the mail or get a denial email from them not getting a grant. Well, if you don't fall within the guidelines of the grant all the way, then you are not eligible. No,
so they throwing it back.
They throw race. They throwing
it how we do. And I'm saying we as a group being that because I see it all the time. Yeah, we can say some things that's foul, but as soon as somebody after we're like, that's racist. Come on.
Right,
it's on both sides. It's on both sides. But
so I hear that all the time. I'm a racist.
That's nuts, man. I'm telling you, it's just too much. It's too much. It's over the top. I seen a commercial today before I came on. I was walking past and I looked up remember the My Pillow guy? The My Pillow guy had the nerve to start, he gave a preface, started his commercial with due to the cancel culture. I said, oh, now they starting commercials that way. So he's starting something else because I guess he was canceled because he's a Trumpster. And I'm using air quotes for the listening audience. So he was like, I guess it was like, get out of here. You know, so he said, due to the cancel culture. And I see that happening more often where even, you know, and speaking of Dave Chappelle, it's like, okay, so we can't be who we are, but you're allowed to be who you are. And then you want to call me something different or a narcissistic person, individual, because I believe what I want to believe. And here's the thing, you can't, and usually narcissism, you know, you have different meanings because y'all keep changing the narrative of everything out here. And I say y'all as people, because people will people, okay? But it's like, it's all about you. But here's the thing, that person calling you a narcissist or because you don't agree with them, aren't you making the situation about you? Why can't I have an opinion? And if I have an opinion and I stick to it and I don't join your club or your side, now I'm narcissistic.
And you don't like me because of it.
Come on, we got to get back to changing the channel. We got to get back to just changing the channel instead of just canceling people, because where's the individuality? We're missing that. All right.
Well, I was actually told I was a narcissist because I said I wouldn't date outside of my race. I mean, not a narcissist, but a racist. I was like, that don't even go. I didn't say I didn't like white people. I didn't say I didn't like Hispanics.
It's
I
preference.
just
It's
said I
called
prefer.
preference.
Right.
See?
It's nothing against another
You're narcissistic because it's all about you. It's a mess. It's like,
and you know what? And I'm going to tell you, okay.
Right? That's it. Exactly.
If you want to call that a narcissist, okay.
So, all right, when you are with family, and we talked about starting Thanksgiving, you said at 2:00. Nick, what's a good time to serve dinner when you're having guests, period? For any occasion when your family's over.
With my family, yes. I'm going to say 4:00 because we always late. Just late.
See, okay, but guess what? See, I can't work with the late people. If I know everybody gonna be like, we ain't waiting all day. This is gonna be the time that it's gonna be.
And I'm the #1 late person. I ain't even gonna lie.
Okay, so you ain't bringing nothing, or are you bringing dessert?
I'll be bringing food, but they be like, listen, you play too much.
Listen, anybody watching this or listening to this broadcast right now, if y'all know her, if she in your family, don't let her bring the food because she gonna be late. She just said it.
You better tell me 2 hours ahead of time.
That is not right.
So I can be on time.
Don't be telling people that it starts at a certain time and then you're doing 2 hours later.
That is not right. See, that's why I don't do that. Everybody bring a dish. I gotta have the main stuff here, and y'all can bring something if you want to, because anybody got time for them green beans coming at 6:00. Get out of here. Or we gotta
because I wanted it with my food.
Get out of here, right? So tell me this. In our culture, we're gonna talk about our culture. So we have, you said 2, you said like 4:00. I say 4:00 for dinner. Christmas I do a little earlier. That's just me. Who says the grace?
Usually, we appoint somebody. We'll ask.
Who are they?
One of my cousins.
Oh, do it. Okay, Feagins. Well, we do appoint people. Huh?
I say by leading whoever God tell you to.
Oh, really? See, I feel like if it's a pastor in the building, if it's a pastor amongst, that's who's the appointed person, or that, listen, or that aunt or uncle who profess, they say, they a Christian, they double Christian, they down, Bible banging. That's who we appointing to say the grace. Because I ain't saying, I ain't calling Keith can't, no.
Well, of course, if
you gotta be careful calling them
or somebody there, then they do the grace. But if you ain't got one of them kind of folks available, then it's whoever.
Okay.
But whoever you know is gonna handle it and do it right. Cause yeah, I'm
You
like,
said
yeah,
do it
I
right.
don't say nothing, cause it'll be ghetto is whatever.
Let me tell you something. I had one of my oh man, or long. You be like, the gravy about to burn. Listen, I had a friend come over my house, and you know, I appointed her to say the grace.
That friend is me. I know this my story.
Yeah, it's her. This clown. This clown said the grace, and knowing I cooked. Listen, talk about something. Listen, everybody got their head down. We waiting. She talked about some. What
Lord,
did you
if
actually?
be in it, Lord, if there's any offense, take it out.
I know it was something. And listen, I looked up. I was like, no, Look, I done slammed up over here. No. All right, who eats first?
The kid.
You say, okay, what you say, Feagins?
Kids.
Really?
Kids, or if grandma there, grandma, then the kids.
Kids and the elderly, yeah.
Or if there's a husband, you know, not no boyfriend, husband.
Okay, all right, well, let me address the kids. The children, okay? Now you said the children. Y'all got to sit at the children's table. If you are 21 and under, you still a child. You one of them. If you are over 21 and still live at home, you at the kids' table. Okay.
But the main reason for the kid aspect is so that you could prepare the plate.
Oh, that's yours. But listen to mine. It is the elderly. The elderly, the diabetics, look, the sick ones, the sick is shut in, the elderly. And then, you know, if you have a pastor in the building, you do the pastor, and then everybody follows suit. But why is it now, before everybody used to just run up in, why is it now that nobody wants to start the line?
Etiquette.
What kind of etiquette?
They try to get talked about.
Mm-hmm. Etiquette.
Now you do look at that.
Like mine, yeah, they'll talk about you. They'll
look at
her running up to the table, just greedy.
I'm starting the line because once you get everybody got that one cousin that do they plate, pack it up, take it to the car, and then get a line and come back and eat again. And then everybody they go and eat everything, but they already
talk about this.
Right. Wait a minute. Remember, Anderson used to throw a beautiful party every year.
Oh, yes. Amazing.
He had to start putting, and he would have signs around the yard or by the food, no take home place, because he would have a party for all of these people. We're talking about the people he worked with, his family, just anybody.
I've never seen no signs.
Y'all don't be looking, because they was there.
You know why? Let me tell you why. Because I'm not one with the take home place. See, you take place home, so you saw the signs.
I don't take place home. That's a lie. The devil is a lie. The devil is a lie.
I ain't never even seen the sign. But yes, that's kind of rude, especially when you come.
Well, see, he didn't do it in the beginning. That was not done in the beginning.
So how do you address that person?
But people were so disrespectful that they was packing up and taking food home.
And
he
when
was
you go
always
to that
having
person,
a party the next day.
But wouldn't you go to that person? When are we going to just be like,
when it's a whole bunch of people that's doing this?
Well, why don't you get security? If it's, just have security sitting there. Just stand there, be like, no.
Yeah, my cousin
this is not what we're going to do.
That's not cool. You pack up a bunch of plates.
Because it doesn't make people feel welcome.
And not only did she take it to the car, but she went around the corner to her house, dropped it off, and it came back and it fixed it, ate again.
And to me, that's not okay. And to me, that's rude because you ain't even, and half of them ain't brought none but some ice. Stop it.
And don't pile your plate up knowing you ain't gonna eat the food. But especially if you know they feeding other people. Put enough for you to eat that you know you're gonna eat whatever's on your plate and get the heck up out of the way.
Now that's nice.
That's a pet peeve of mine.
But if it's a long line and it's a whole bunch of people, you be like, it's gonna be done and it's over. But I don't like my food to touch, so I ain't piling nothing up. I had like 4 or 5 different plates with different stuff on it. But I think that is kind of like, I think it's foul to take stuff home. And I'm going to go on the line. And then they throw it away. How about that? They pile the plate up and throw it all away.
Right. That's what I'm talking about. And I see it so often, and it burns my soul.
You can, if you come to one of my events or parties or anything like that, let everybody get whatever they're going to get. Then you can take it all home, because I'm not trying to put nothing away.
Thank you. Yeah, afterwards, let everybody eat first. People don't be wanting to let everybody eat. They want to make 2 or 3 plates at the same time. And no, we ain't doing that. We ain't doing that.
Now, what about that person that comes late and talk about everything gone?
Well, you should have been on time so you could eat.
That.
Middle finger, but we on Zoom.
I said they're like, we're just trying to make it right for the lovely people. Just trying to make it right for the people. Did you guys?
Should be a
Go ahead.
There should be a standard etiquette when you're eating at someone else's house or out in public, like to venues, weddings, and things of that nature.
I hope it should have been, and I hope that it is. It's always
it probably is, but people
when you are
don't
invited
know.
When you are invited to dinner at someone's home, you must bring something. Now, I am that person to be like, y'all don't worry about it. But if it's a bottle of wine, if it's a case of water, if it's, here's some toiletries, like some tissue. And I'm going to tell you, that toilet paper come in handy, just like a 4-pack, because you know that they have guests there. And don't be going to the bathroom 100 times. Let me add that too, because we're going to think you stealing. Like, why you got to keep going to the bathroom? They keep missing.
Water pill, girl, water pill.
Yeah, some people if you're taking a water pill, I want to know about it, because I need to know why you got to keep going up them steps. Like, what you doing? They stealing. Go on up there. I be sending people. You know, I have my appointed people, Nick. I be having a finger. Soon as somebody go, I'm like, that means go up there and wait like you got to go while I entertain here. But like a bottle of wine, some cookies, a cake, you know, store-bought, whatever. I just can't go empty-handed to somebody else's place. I just can't. Even if they don't even use and they got 4 people here. Now y'all got water for the rest of the week. You know, something.
Right.
So I just think that's...
I'm going to remember that on the next party I have.
Man, you had about 9 trays of vegetarian baked beans.
You came over the next day and ate.
I did, and I got some of them. You had 4 trays.
And then went to sleep.
Listen, Nick, she got 2 stoves in her house.
Well, dang.
I know. Who knew that this? I didn't know vegetarian baked beans could be made 4 different ways.
She's stupid. No, I didn't, Nick. Don't you believe that? That's a lie.
This is pepper.
It's a lie.
Pepper baked beans. Look, vegetarian baked beans. What's that over there? That's made with green. They got the green bell pepper in it. Let me try. Addressing everybody's allergies, right? I'm like, I can't. Am I missing anything else? Look, see what I'm saying, Nixie? You see me watching her over there. She hydrated. Turn the heat down.
No, I'm eating my food. That's my food.
Oh, that's all you doing? Oh, you on a liquid diet?
Gotta get my protein.
Oh, I ain't doing that. Yeah, I fell off. So if you drink Ensure, because that's real sweet, we should really, do you brush like after?
Mm-hmm.
Because that's like.
But there's only 6 grams of sugar in here.
I don't know. That's nasty. I look at the thickness like and it has to be cold, like a milkshake, like real cold, not warm.
It's difficult, but when you don't eat enough calories and you need protein is very important. A lot of us don't get enough protein. Mm-hmm. Women should have at least 60 grams of protein a day. Mm-hmm. I mean, you know, when you have eating issues, you have to do something. Eating
disorders. Not all eating disorders mean that it's a bad thing. because there could be
I
an
said
issue.
eating. I said eating issues.
Yeah, I said disorder because that's classified under the eating disorders if you're not able to get the nutrients that your proper.
And I'm not anorexic or bulimic.
That's why I said all of them. We know. Look at them boobs.
You know what? They ain't gonna go nowhere.
They ain't shriveled. When they shrivel, then I start questioning you. Like, hold on, hold on now. That's how I be looking. I'm like, oh, okay, they good. Okay. Go up there, be like, hey, girl, how you doing? All right. Yeah, you're not dehydrated. Pull it in. Is there any tinting? No tinting? Okay. Yeah, you good. You got enough fluids. I love your ring and congratulations again, Nick, on your
congratulations
on your upgrade.
Thank you.
Yeah, it looks amazing. That's great. And it's a holiday season. And for those of you, let me put this out here. For those of you, because I have, my two people that are on today, they lost their moms. And I saw where, on, social media sites, it was like, family. But for some unknown reason, I was just sitting there and it was a lot of, I wish my mom was here. It was a lot of moms. I didn't see as many dads, but I did see the moms. And I'm like, oh, that has to be something. Thank God I haven't experienced that. But for those of you who lost loved ones, especially in the last 2 years, I can't even imagine because I know 2020 just seemed like we just skipped past it. And I'm like, wait, did that just happen? And those who have lost.
My mom been gone for 7 years and I still. The holidays will never be the same, ever. I don't care if I'm around a bunch of family. It's just not the same.
And see, this is where I was going with that, with the moms. I'm thinking that it's the holiday times and the moms usually cook or the mom give you directions on how to make something. They yelling like, put this, or we pick up the phone and we like, okay, wait, how do you make this? And those are things that we kind of take for granted. And we just like, oh yeah, I'm about to call. But those who have actually lost vital people in their lives, coping during these holiday times, give them, before we end the show, and Nick, I'm gonna ask you first, give them some words of encouragement on how to get through the holidays.
Just remember all the good times that you have during the holidays. That'll help you get through.
Okay.
Those good memories.
Oh. Okay. Ms. Feagins?
Words of encouragement, a lot of prayer. That's the only thing I can say, because outside of that, you have not a leg to stand on. That's it.
Go over your friend's house.
Yeah. And I wonder why I got that invite. No.
You guys, just so we sit there, be like, come on over. Come on over. You know what?
I know Nick, something behind it. Now as I know.
Nick said something really vital, because usually, like with our culture, I don't even think it's just us. I think, just the human race. When we all get together and have a family gathering, we always remember and talk about the deceased. You remember something funny that happened before, or you'll be like, oh, my mother, I remember she made this, and this is how she did it. Or like you were sharing, Miss Vegas, when you were saying how your mom at her age, she was able to get up off the floor, and you sit there like, oh, when you were talking about baking.
I still can't get off the floor.
Got to roll over.
Exactly.
And that's what we do. And then if we have that one person that did time locked up, everybody at the table, don't ever bring up why they was locked up. We like act like that didn't happen, and we go on from that day forward. When you have to be like, oh yeah, here come Petey. Up, Petey walking to the door. Yeah, he did a bid. Oh, okay. And then everybody sit down. Hey, Petey. But you never ever bring up what really happened.
Right.
But guess what bring it up? Me. Now they told me this. Now let's talk. What really happened? And
right. Exactly. I'm gonna be the one that asks questions.
Yeah, right. Be like, hey, let's go in the back room while everybody up there, or go outside, because you got them two cousins that be like, we'll be back. We'll take a walk.
or sit next to them and whisper.
Yeah. Listen, my cousins already know when I do this. They already know.
They know what's coming. Everybody's ear peaked like, I don't want to bring it up, but since you're addressing this.
They know I'm about to be ignorant.
Did you guys go Black Friday in it?
You know what? I stopped at Walmart, but I think everybody's doing their because there's really no good deals or nothing. I think everything is online. I went in Walmart yesterday, like, really?
And here's what
I ain't working for free.
You don't want to go through the self-checkout? I know that's right.
I don't work for free. And you ain't giving me a discount? It pisses me off when I see people in the self-checkout line. Yes, I said it. It pisses me off to my core.
Be waiting in line for nobody. So I just
I don't do it because I don't work there and we're putting somebody out of a job, even though they probably think it's easier. But I'm like,
people don't realize that.
But I will say this. For those, we know that now, because I checked again as far as for like holiday meals, that the food, I thought it was 3%. That's what it was before, earlier in the year. The food is now up almost 14%. So watch that and get your meals now. I don't know where, I guess everybody in the world used Velveeta for their macaroni and cheese because that was a mess. It was out for a long time. Now, the Black Friday, if you guys remember, or maybe you didn't know, let me go ahead and educate you real quick. Educate you. You heard that. Edutainment. That's it. Okay. That wasn't a speech impediment. Here's the thing. What Black Friday is usually when things are in the black, meaning they have gained more. Stores are usually in the red. When they're in the black, it's like, okay, we have a profit. So we're able to mark these things down. That's why I didn't go Black Friday, and because I said it's not Black Friday because of 2020, they're still in the red. That's why they're charging us. Remember they had that COVID tax or some mess, COVID fee. You remember that, Nick? That they were adding like on restaurants.
Like for real?
It's like, wait a second. Wait 1 second. You had that. You have restaurants, they went up on their food, which I understand that. You know, you go up on your food, just put it on there. Don't tell me, now I'm going to say this to my caterers out there. Do not give me an explanation as to why your prices increase unless I ask. Because this is me. You telling me that meat went up, milk went up, blah, 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 all this stuff went up. And then you get upset that people don't want to use your services. And then you got to explain why, because we know what went up. And if that person don't want to pay the cost, let them go. That's not your customer. If you charge whatever before and it's like, okay, and then now you're charging this and they're like, oh, no, thank you. And then you want to get upset. Come on. And of course, we know at the family gatherings, we talk about the GoFundMe, and I'm gonna address that. And we got 3 minutes and I'm out. GoFundMe for people who don't have insurance for their children that are, well, actually not even their children, because I'm down for the children. Something happens, boom, 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 I got you. But adults, I just feel like they live on their own. These adults live on their own. Because remember, I told you 21 and over, if you still living at home, you still a child. You sit at the kid table still. But to get upset is where my issue is at. When you put it out there, do what you feel you need to do or want to do. But don't get on live cussing everybody else out because they're choosing to do whatever it is that they want to do with their money and not donate it to you.
Who did that?
It happens more often than not. And when you get it, it's like, okay, or when you, and it's not, there's no issue with asking because you can ask for whatever you want, but don't get upset that people aren't even able to give, because guess what? Just like you don't have it, they probably don't either. Mm-hmm. And I'm like, if you want to go fund me, that means you don't have it, but guess what? Your neighbor don't either. So don't get upset about that, because this pandemic didn't just affect you. It affected everybody.
It affected everyone.
And let's talk even pre-pandemic. People are on fixed incomes. Stop expecting or looking at people thinking that they have and wanting to pull from them, because those very people that you're pulling from, you didn't pour into. And you'll hear me say, why are you upset that you can't take a withdrawal when you never deposited anything? And that's for my people too that go to the church. You go to the church for your need, but guess what? Somebody has to deposit, and you ain't paid a tithe. You ain't paid a tithe, but you going to the church because you need help with A, B, C, and D. You're not depositing. And if you don't have enough money to even pay a tithe, you could go up there and be like, hey, I'm donating these books. And y'all know I'm gonna say books because that's my thing. Here, so that somebody can increase their life. You know what I'm saying? Go ahead.
What about someone who has paid tithes and then
Now,
go to the church
because they issue.
But wait a minute, they paid tithes for years, but now they get in a bind and they need from the church, and the very church they tithe to can't give them nothing. Say they can't give them nothing.
And see, that's why I have an issue. See, a long time ago, Bush was talking about, and that's why I was sitting there considering. I was like, I like that when he was talking about Social Security. And he was saying that, like now, where we are now, that we won't have it because of the baby boomers. So it's like, oh, your Social Security gonna be gone by the time you get it. But Bush, long time ago, when he was running, he was saying that he was running on that. Whoever paid into Social Security, they'll be able to keep their Social Security. So we paid into Social Security working, and that's our money when we need Social Security. But
as we know, it's not enough.
It's right, but guess what? It could have been, but no, we didn't do that. He ain't no longer in office. You know, I mean, by the time I needed it. But that's the same thing when you deposit and you can't withdraw. And most of them probably can't withdraw because they're given to somebody who didn't pay in. And people are under the misconception of the church is getting money from the sky or off trees or something. I'm like, yeah, you could go to the church and the church, you know, say, oh yeah, they'll provide, we'll help you as much as we can. But if nobody's pouring in, how can they? How can they keep their lights on? That's why a lot of churches are closing too. And they're like, why are the churches closing? They can't afford it. They can't afford it because it's like, okay, you go, you pull, you withdraw, but you're not depositing. Is that fair?
The church dynamic is changing now, especially since after the pandemic. It's mostly, it's a lot of online, and I'm quite sure people are still tithing. And so if you don't have, per se, a brick and mortar, now you can do more things.
Yeah, and you really could. You really could. Listen, that's another show. Hey, lovely people, today's footnote is, and this is from the lovely Mel. Allow people to be exactly who they are. Allow people to be exactly who they are. You have a choice to deal with them or not. Stop with the cancel culture. Just change your channel. All right, lovely people, that is my time. I thoroughly enjoyed you as I do each and every single Saturday. Thank you, Miss Feagins, for educating us on.
You're welcome. Hope everybody enjoyed.
On the yuck mouth.
Yep.
And thanks, Nick, my girl Nick. Let's keep everybody in prayer. Nick lost a family member. We're still doing it because the show must go on, and we do what we do. So here we go, lovely people. Find you, embrace you. Most importantly, always, always love you. Until next week, people. ShopTalk on all your podcasts. Look, whichever one you like, tune in. All right, your favorite podcast, and like us on all socials while we have it right here, okay? And you can check the show out if you want to see our lovely faces on YouTube, all under Shop Talk with Mel. And you can deposit into the show by just liking and listening. I ain't asking for a dime. That's it. Like, comment, and subscribe. All right.